October, in case you didn't know, is Joint and Bones Awareness Month, and these types of injuries are preventable for the most part. And with advanced technology we have these days, they're actually easier to treat now than ever before. But joining us this morning is Dr. Tom Thomas, who is an orthopedic surgeon from Swedish Medical Center, to tell us more about this, fill us in on the warning signs and what we can do. Thanks for being here.
You're welcome.
Okay,
Thank you for having me.
What are some of the common injuries we usually see this time of year?
This time of year, orthopedically, we have sort of seasons just like the year. Mm-hmm. And we've gone from summer, where everyone is active and out doing things, to the fall, where it's a little bit cooler. Outside activities get decreased, but we have sports from all the schools that come in. So we go from bicycle accidents and falls from climbing and things like that to more injuries from sports. And those are more ligamentous type of injuries, mm-hmm. as opposed to fractures of the femur or tibia or shoulder from most of the summer activities.
And we always talk about prevention, and we often hear calcium is important to add to our diet. That obviously can't help, right?
That can help. We're also getting into the slippery weather, and we see a lot of hip fractures, slips and falls, so ankle fractures. And their hip fractures are especially common in older people. Mm-hmm. Calcium intake and vitamin D intake are very important. And
exercise can also help too,
exercise
right?
helps. Weight-bearing type of exercises, walking, actually, there was a study that showed that just standing and jumping is better than walking as far as bone density. And resistive exercises with weights will help put stress on bones and increase the density of bones.
The good news is, hopefully you don't get injured, but if you do, there are a lot of treatment options out there, and a lot of them with shorter recovery time as well, right?
That's true. And it depends on the type of injury. If it's a fracture, you can recover faster at times if it's stabilized internally with operating, as opposed to a cast and then have to recover from the stiffness of the joints we call sort of cast disease. Mm-hmm. But some are more amenable to cast treatment and non-interventional treatment like surgery.
Okay, well, this is obviously just a good reminder as we head into the cold season. There could be ice on the ground or anything like that. Just be careful if you head.
Be very careful.
All right, thank you so much, Dr. Thomas. We appreciate your time this morning.